Welcome to Bastier's Maternal-Child Health Systems. I'm just waiting to make sure everybody comes into our session. I'm Carrie Scully, and I'm an admissions advisor here at Bastyr University. And I'm here to introduce to you Kristen Eflin, our program director, and also a Bastyr alum as well. I wanted to let you know that we will be, please put questions into our questions and answers chat box as we go along, and we will get those answered at the end of our session. So welcome and thank you so much for connecting with us today. So Kristen, why don't you take it away?
Sure. Hello there. And thanks for showing up at the end of a week. Um, we appreciate you coming, and we definitely want to be able to connect with you and answer your questions. So here you see some of the faces of our program, and really our students, our graduates, and our faculty are the heart of the master's degree program here in maternal child health systems. The students spend a year putting together incredible projects that impact their communities. Here on the right, we have some of our faculty. As Carrie mentioned, not just myself, but some of them were once students in the program themselves. And we know, oh, sorry, next slide. We know that you probably would not be here if you thought that families and communities were able to consistently access the quality, culturally relevant, and humble care that keeps them safe and enables them to thrive. Unfortunately, we know this is not the case, and we know that BIPOC families and communities are most impacted. This image here is from a film screening we held here on campus. And, it is one of many trying to raise awareness about the huge problem we know that we have. It's why we come together to learn because we all want to make an impact. Next slide. Luckily, we aren't without hope. This program was created to offer folks like yourself more opportunities to make a difference in these outcomes in your communities. Both of our programs, the one you're here today to learn about, as well as our clinical midwifery program, are centered around social justice. Here is a picture of one of our alum who works in the Bronx. She was featured here on Public Health Live, but she works for a federally qualified health center running their community health worker program focused on improving maternal and infant outcomes there in the Bronx. Next slide. The Maternal-Child Health Systems Master's Degree Program was developed from the ground up with a social justice focus. I often say that many of our students come to us with so much lived experience that they actually deserve a master's degree before even starting with us for all the work they have done in their communities to work towards health equity. But importantly, they all report that along the way, they also get to learn and really learn how to increase their impact as advocates, as leaders, all the while learning how to conduct research and impact systems change. And here you see two more of our graduates, one from each program actually, running an amazing program down in South Seattle. And the other now works for Congressmember Adam Smith on his maternal health policy. She also, does grant writing for him. And so it's really cool to just see where folks end up, finding ways to improve our broken systems. Next slide. Throughout the slideshow here, you will see photos of our graduates. They really tell the story of why our program exists. Here is Erica McAfee. She is the founder of Sisters in Loss. Perhaps you have heard of her podcast. This organization is really incredible, supporting folks after the difficult experience of loss, and especially women of color and Black women and families. And, we were so grateful to have her, as we are all of our students. She had the great pleasure of working on Black maternal health with the current vice president, which is pretty exciting to have that opportunity. And funding has come, through that work. Students learn here how to improve their advocacy skills, how to help create that research to make a difference, and that data that's needed to be able to get funding and to shift policy in our direction. And really that systems thinking. I was at a public health conference in Washington State, and many of the folks who ran the public health department, they were lamenting how some of the graduates come out of the public health departments and they really don't have a good understanding of how to work in community, how to, work with stakeholders, collaborate well, with diverse stakeholders, and have that systems thinking perspective. And I thought, well, goodness, that's exactly what our program is. And so really ready for the workforce and having that practical application, even in the program, starting to think about the work that can be done afterwards and concurrently. Next slide. Another graduate here, really out there doing the good work. Faisa Farole has been featured in the Seattle Times 2 or 3 times for the good work at Global Perinatal Services. They have doulas offering, community-based doulas offering care, as well as midwifery services, perinatal, postpartum care, and really offering that culturally congruent, culturally matched care, also in South Seattle. Next slide. And here, this is really showing me with some of our students doing one of my favorite things, learning how to use their voices as advocates and making a difference in health policy. Some of us do it in person. Some folks, learn to do that virtual work with their elected officials. But really following this soul calling to do work that is not only important, but that we really care about, and how to do it in bigger and better and more impactful ways. Next slide. So for folks wanting to transform the perinatal and postpartum health systems that we have in this country and beyond, we have a student now who, a recent graduate working in the country of Liberia, high up, working on midwifery education and trying to improve the workforce and the availability of and access to midwives there. So it's really across the board. We have a graduate in Australia, Puerto Rico, but here is just an overview of what the program looks like. So it is 1 year, unless you want to do it in 2. So this is kind of nuts and bolts. It's really a fast, intense year. We get to know each other in person for just 3 days. And so you get to know your other classmates, who you actually get the great pleasure of learning what's going on in other parts of the country, and good programs that are functioning well in other places that can be models for where you are. But also meeting some of your faculty, and then online on Tuesdays and Wednesdays are our synchronous virtual classes, and otherwise completely online, in your own time, reading and engaging with those learning resources. Let's see, I lost my train of thought there. Here's some of our more beautiful graduates. But basically, the program allows you to stay in your own community, as well as develop that independent project that has that possibility of bringing back to your community as well. At the end of the program, after just 1 year, so July is our first days together, and then by June, the end of June, is 2 more days in person, where you present your project, and we have a little tiny bit more class and then graduate. But also it can be done in part-time for those who are working and also maybe have small children and want to make it a little bit gentler process for getting that master's degree. Next slide. So who is our program for? We really have had folks from all different angles who care about this work, right? So we've had social workers, we've had folks who are in public health, but maybe can't move up with the work they're doing because they need letters behind their name before they can move into different positions. We have had midwives, some who've been practicing a long time, some for a little less, but they may be ready to do less on-call time, and they want to, start a nonprofit organization, or they want to go work for another organization or start working in public health. We've had doulas as well as lactation consultants, um, and really folks come because they care about families and they want to make a difference. And so if you have been working, for at least 2 years in these areas, we just look forward to chatting with you. And, we've had nurses as well. So just a variety of folks who are interested and, and qualified to be able to come. We really have a program where we want to recognize your lived experience. So we have had community health workers as well, where they are already doing such good work in their community, but they can't really move forward with their work and be recognized for all that they contribute, sometimes unfortunately without those letters. And so we also get folks who really want to have this laser focus, right? They might have a broad interest in public health, but really they don't want to spend time on other things. They want to focus on perinatal health, postpartum and infant health, maternal child health. Next slide, please. So these are the core competencies, right? These are the things you get to achieve by, entering and going through with the program and completing the learning activities and projects. And so this can look like all kinds of things. Featured here are 2 different graphics from some of my publications, since I did graduate from the program as well. The first is, looking at health professions education and how we can have more of an equity agenda and an equity social justice focus in health professions education, as well on the bottom here, thinking about advocacy and how to really make an impact with legislative change in our jurisdictions. So as you can see, it's across the board, getting to learn about research, do research if that is a passion of yours, learn how to find data, use data to make your case for change, and as well making sure we're doing that with a human rights focus, being ethical with our program development and our research. Also, focusing on policy and how to again affect change in that regard as well, and also thinking about the way the whole healthcare system works and how we might improve it. Next slide. This is just, a quick overview of the curriculum and some of our graduates there and a faculty member as well. You really get to start out with a power and privilege course, and making sure we all have that lens and confronting our own bias, as well as thinking about social justice broadly. Again, that focus on research, systems thinking, also management, right? If you are in a place where you are, one of our graduates ran a federally qualified health center, was the, I guess it's a CEO of the FQHC, right? So if you are in these leadership roles and management roles, how can you, do that well and learn about doing that well? We also have a global MCH course as well as that independent project. Next slide. You get to see here just a couple of the books that are part of our required textbooks and in our curriculum. Everything from, some of these public health books, as well as, Reproducing Race, for example, was someone's dissertation, right, that has been put into a book, really thinking about, again, how to transform these systems, birthing justice, reproductive justice, and confronting racism as well. Next slide. This is kind of how it breaks down. I think the names of the courses don't sound nearly as interesting as they actually are. One of these days I'm going to work on that. But you can see it's basically 4 courses per term if you're doing it full time. And many of the quarters there is a research class. Also, that independent project goes through each quarter. And then, as I said, we have different classes focusing on leadership, management, advocacy, integrating culture and social justice, and utilizing health data. So next slide. So, folks usually ask themselves, why me? Why should I do this program? And it is, an investment that we all choose to make if we do the program. It's, not an inexpensive thing, but it is, because it's an efficient program that's 1 year long, it ends up actually costing less than an equivalent degree. For example, a public health degree with a maternal child focus, you're going to take 2 or 3 years to get that done. And so then it ends up, costing more because of that as well. And so we really hear from our graduates that it opens up doors to have a seat at the table. One of our graduates who works for public health in California, she worked for, as a midwife for years. And she could see all of these things that, needed to be better for her clients, for her families, and for, the way our system operates. And she said, now I'm actually at the tables where these decisions are being made, where funding determinations are happening, where programs are being developed and decided. And so, that's the point, right? Is to be able to have a seat at those tables where decisions are being made. So it does help sometimes to have that degree. The program is online and flexible. You do get to stay in your community. We do ask folks to make that investment of coming together in person because we find that it is really valuable for really just creating this cohesive community, this learning community that we can then translate to the online world for the rest of the year. Next slide, please. It's kind of hard to read this one. One of the most common questions that I get is, what can I do with this degree when I'm done? So I've given you already some samples that are listed here, as well as others. So, we have folks who work as lactation consultants inpatient at a hospital. I am a professor, right? We have clinical directors of programs. We have grants coordinators. We have folks who work on maternal mortality review panels. Founders of organizations, that sort of thing. So you're welcome to pause and look at this later for the recording if you'd like, or we can send it to you as well. Just a few examples. Next slide.
Great. Thank you, Kristen. That was such a great overview. And now you get a little bit of time with me, the admissions advisor. I'm going to be the cheerleader to this process. So I want you to be able to pair with me and I'll help support you along the way. So, what do you need as far as this program? What are qualifications? So, we do accept a bachelor's degree, an associate's degree, or equivalent credits. There are 90 quarter credits or 60 semester credits. So this is going to also be from either accredited university or the MEAC accredited midwifery program. We are also looking for a GPA of 3.0 or higher. Now, if you don't quite have that, we can also look at your last 45 credits. That's around your last year to be able to maybe meet that GPA. We're also looking at your resume and qualifying the years of experience that you've had either in lactation specialists, a doula, childbirth educator, she had mentioned even community health. So we're looking for those 2 years of practical experience. And then as part of our application, once we have passed all those things, we'll be asking for a writing sample. So program deadlines to pay attention to. We just passed our November 1, but January 10th is a date to pay attention to for our priority deadline. And the reason why you want to pay attention to that deadline is there's a scholarship attached to that. And I'll go into that in in a few slides next. And then at April 28th is our final deadline, so that we have time to process before your summer start. So, what are the prerequisites that you're going to need? People are usually wondering where they can take these prerequisites. So, we're looking for basic statistics or biostatistics in the last 5 years, and that's so that you can come into the program and be ready to go off and run. Um, we're also looking for English composition or writing, and then public speaking or equivalent experience. And so you can pair with me to look up these classes at any community college. We also have online options if that's easier for you. So we can discuss that and work out a plan. And then how are you going to apply? We have our application online, and will just be filling in your personal information and a personal summary. And you don't have to worry about letters of recommendations or test scores for this, but you will want to include a resume as part of the application process. As far as official transcripts, we are looking for transcripts that come from any college, university that you've attended. That can be something that you've taken 20, 30 years ago, or one class that you might have taken somewhere. Yes, we will need all transcripts sent to our appstat at bastyr.edu. And once those are in, we can start evaluating the process. So we do send email updates as we go along in the process. So please do check your email regularly. And as a thank you for attending today, we wanted to waive your application fee of $75. So when you do apply, add future Basterian, that's all caps, all one word, future Basterian, into your application. So thank you so much for attending today. And I also wanted to let you know what the next steps would be. So after you've applied and your official transcripts are in, our uh, um, admissions committee will be evaluating that and getting in touch with you. If we're inviting you to next steps, that would be an email with a link to select an interview time. So you have time to prepare for that. And after you get admitted, there's a few things too to pay attention to. One will be an email with some directions on how to pay your deposit. And we'll also be sending up some information on how to set up your Bastyr email. Once that Bastyr email is set up, all of our communication will be going to that particular email. So you do want to check that on a regular basis. And then financial aid, I'll talk to about that in a moment. But all your classes need to be completed by the time the program starts. And if you're still finishing up an associate's degree or bachelor's, then when you do get graduated, then order another official transcript would be great. So this particular program has an interview component to it. So one of the things that you can do to prepare for that is talk to faculty, alumni, other industry professionals, so that you're really in tune with the your profession and also our particular program. We're going to be asking you some questions to see if you were a good fit, but also make sure that you have some questions for us so that you get things answered. And because it's a big decision to be able to start your master's degree. So come prepared to ask some questions as well. And if possible, we'll be sending you an email to complete a writing sample. And if you can do that before the interview, that would be great. So financing your education is obviously a very critical part to coming to Bastyr. So here's a few facts for you to pay attention to. Submitting the FAFSA, that's the federal application for financial aid. I believe the application this year opens December 1st, so it's coming up. Our school code is 016059. And also, you will need to submit a financial aid application with us as well. Financial aid is hoping they can get that by March 1st. Of course, if you're applying later, then you can do it as soon as possible. But be checking to see if they're asking for additional application documents and do it as soon as possible so that you have the best knowledge of what finances are available. I did want to mention that scholarship that I had talked about earlier, and your priority deadline for this program is January 10th. And anyone that has a GPA of 3.0 or higher and applies by this deadline is eligible for a $1,000 to $5,000 scholarship award. And you do not need to enter this separately. So that's why I encourage everyone to submit their applications by January 10th. And you can check our website for other current scholarships that might be available or outside scholarship opportunities. To connect with our financial aid department, you can write finaid@bastyr.edu or get in touch with Nancy Chrisman, and her contact information is located here. So what's next? Come meet with me. I would love to look and see what your transcripts are and put together a plan. I'm here to help support you along the way. I can connect you with Kristen. If you would like to come for a tour, I give tours in Kenmore every week, so you can sign up for that. And also come visit our bookstore, but also connect with us on social. For those that aren't able to come visit, that's a great way to see what's happening at the university. And that might also help formulate some questions along the way in your interview process. So now we're opening up to see if there's any questions. Thank you so much. I don't see quite any. But Kristen is happy to get in touch with you to answer any of those questions. So she has graciously added her email here at keflin@bastyr.edu. And my email as well is kscully-advise@bastyr.edu. Another way to get a hold of us that might be easier to remember is admissions@bastyr.edu. So with that, I'd like to thank you for coming. Feel free to connect with us. Either of us are happy to get your questions answered. And we thank you for your time at Bastyr and hope to see you soon. Take care.